So today let's talk on health. Yesterday we had a day full of talking on wealth as Dr. Chadha, economic health as with Dr. Mrs. Chadha. We talked about family relations and mental health. Yeah, mental wealth. Yeah. But let's go back to our health. And now I'll focus today on the immune system. I have broken my talk into two parts. First part, I'll be just introducing you to basics of immune system, because all along we are talking about inflammation, we are talking about interleukins, we are talking about our immunity. So what does it really mean and what exactly it is? I'll just like to give a very brief and very simple introduction. So as rightly pointed out by Vaishali, this PNI, every day we are listening to this word, and definitely there is a connectedness between all these systems, the psycho, neuro. Yesterday we had a very wonderful session with Bhadbhade madam about this autonomic nervous system taking charge of our body. And today I'll be talking a little on this immune system as well. So any disturbance in any one particular system will definitely is going to affect the other systems as well. How? What do you really mean by immunity? If you take the word and if you see the dictionary meaning of it, it's kind of a state of protection. And it came in science as protection from infectious diseases, but previously it was an exemption from military services or duties or taxes. So immunity word actually came from there, but in science we are using it as a state of protection against infectious diseases basically. So immunity is our body's ability to resist or eliminate potentially harmful or noxious stimuli from external as well as internal system also, because it has a very crucial role in defense against invading pathogens which are in form of viruses, bacteria. COVID has been a very recent example and everybody got aware of this immune system because of this nasty infection. Then it not only stops the invading pathogens, but it also removes the burnout cells of the body and tissue debris, which is there as a result of tissue injury or a disease. It also identifies and destroys some mutant cells. So there is definitely a primary role in identifying the mutant cells, which can lead to further carcinogenesis or various cancer developments. Then rejection of foreign cells. Whenever we do listen to kidney transplants and the various other corneal transplants and all, and there are some rejection cases where the body doesn't take up the other tissue. And there the role of immunity comes over there also. And lastly, when it behaves inappropriately, the immune system doesn't behave in its proper sequence, then definitely we land up with other diseases. Most of them autoimmune disorders, what we call, we deal with in rheumatological problems. And there are some allergies which are responses to normally harmless substances. The body has an hypersensitivity for those kind of issues. So this immunity is basically having two components. One is an innate immunity and the other is an adaptive immunity. The innate immunity is a kind of a first line defense where body has many physical barriers, like our intact skin, that is an important physical barrier, intact mucous membrane, mucosa of our mouth, oral system. So that is an intact barrier of our intestine. Definitely all these act as primary defense to any invasion of microorganism. The first defense that definitely plays a very crucial role in primary confrontation with the pathogens, but it has some lacunae. It doesn't have any antigen specificity, so it can react the same way to any intruding pathogen. There is no time lag. It is an immediate kind of response, and that's why there is no memorization what kind of response it has given to that particular pathogen. But vis-a-vis, adaptive immunity is a little evolved immunity, where the individual has learned to respond to some pathogens in certain way. That's why there is a little delay in the response. There is a lag period. It is more antigen specific, and there is definite development of memory cells which can later on react to that particular pathogen. So a typical immune response, what we call, has got this innate immunity response as well as acquired immunity response. The innate immunity response, where there are external defenses, as I mentioned, skin, mucous membrane. Then there are some body secretions. They can also act as kind of innate defense, which is in form of tears, in form of saliva, in form of gastric acid. So definitely they are also kind of protecting our body from other pathogens, from external noxious stimuli. Then there are some internal defenses in form of various cells, the phagocytic cells, the proteins in the body, then the inflammatory responses they produce, the natural killer cells and complement. I'll come to it. And the acquired immunity is mainly a cellular immunity, where there is a humoral response in form of antibodies and there is a cellular response in form of cytotoxic cells. So this is the innate internal responses in form of cellular and extracellular. As Sir was mentioning about 3 C's, here also we have got 3 C's, which are the extracellular components, the cytokines, the complements and the coagulation cascades. So this is how our blood looks. The blood has got a cellular component in form of this red blood cells, the WBCs and the platelets, and the rest of the plasma which has all got this complement proteins, the coagulation cascades and the cytokines. So these are the white blood cells. These are the lymphocytes, the B lymphocyte, T lymphocytes and the natural killer cells. Then this is a monocyte. We all know there are 5 types of white blood cells. So this is the monocyte which goes into further differentiates into a macrophage when it invades the tissues. And these are basophils or mast cells which are mainly producing an allergic response in the body. So the neutrophils are the dominant cells which play a crucial role in innate immune response, and they are efficient phagocytes. Phagocytes means they just engulf the antigen or the microbe, whichever is coming in its way. The most important cells. The monocytes we talked, these are the ones which migrate into the tissues and they become macrophages. So they are labeled in different organs differently. When they invade lung, this alveolar macrophage. In bone, they are osteoclasts. In brain, they are called microglia. And the Kupffer cells and the intestinal macrophages. So they are big eaters than neutrophils. They phagocytose the microbes in the tissues. And they also play an important role in antigen presentation. Whatever they engulf, they have to present it to the adaptive immunity, adaptive cells in order to produce further responses. These are natural killer cells. They are not B or T lymphocytes, but they are an important part in innate. And they kill the virus, bacteria, infected cells. And even the cancer cells also, they do have a role in that. This is how does that killer cell kill that particular mutant cell or the cell which is infected. So they do identify, there are some protein again receptors on the cell which are identified as self, and if they are not there, then they are identified as foreign and then they are killed. Then there are some toll-like receptors. What I was talking about, these transmembrane proteins which are present on macrophages as well as few other cells, and they are important again in order for presentation of antigens to the defense system. So what happens when a TLR binds to a microbe? This is what is there. So there is secretion of cytokines, interferons, there is phagocytosis of infected cell, apoptosis, that's a programmed cell death, what is called, of infected cell, and inflammation.
Now I'm watching a video or a TV. Relaxed, okay?
Very much relaxed.
Very much relaxed. Yes. Okay. Now I want to work on my laptop. Right? If I am driving something. Hello? Yes? Yes, speaking. Okay, can you call me after 5 minutes? Yes. Okay? Or if I'm carrying, I am going to just take this. It's carrying. So I'm carrying this.
Yeah, I do that. Yeah.
Now, if you want to pick up something from the floor, something is dropped down like this. whatever you are using your body. So all these are wrong postures. Okay, so you are continuously using your body in a wrong way. Okay, and because you are not paying attention how the body should be used, and then we land up into the low inflammatory
Namrata.
sort of.
What about reading the Kindle like this?
Yes, that is what.
Not allowed.
Not allowed. Okay. Okay. So all this is going to propagate towards us to the low inflammatory responses and something called as repetitive musculoskeletal injuries. Yeah. Repetitive musculoskeletal injuries. Okay. So I will tell you now how you should be doing some part of it. Okay. So many patients come to us that they are sitting like this on the floor for puja. That is the most important thing that they have to do. We have to sit down, ma'am. And they will be sitting like this and they will be worshipping the gods like this. Okay. So for them, what we tell them is if you want to sit,
Below the hand.
okay, so take something underneath your hips, okay, so that the hips are elevated and your knees are down, okay, so automatically your spine remains straight. So we never say no to sitting down, but sit like this and worship your gods, and whatever you want to do in the sitting position, you're supposed to do like this, okay. So this is the good sitting, right? Next. Yes. Yes. Every time whenever you are sitting, if you want to align your spine properly, this is the proper position. Okay, if you ask me how much is the elevation, is your hand is the assessment tool for you. Okay, because every individual is different. So this is the width that we take. Right?
It is a hard or it's a
It's
foam?
It's a foam, polyethylene foam.
Foam.
Yeah. Okay. Yes. No, we have designed it now. Yes.
And it has to be in that height.
Slanting position. Yes, because the hip has to be up than the knees. Okay. Then coming next to the sitting on a chair. Okay. So the prerequisite for sitting on the chair is your feet has to be supported on the ground. Okay. If you don't have it, you can have a bar underneath your table where you're working and you can just keep it over there. Okay, but no sitting like this. This is a very bad sitting position. Next, if you want to maintain your spinal alignment in a good health, if you don't have a rollators, that is the rotating wheels underneath your chair, what you can do is the use of a brick that we were talking about is just to elevate the chair like this and sit on that.
It has to be sloping like this.
Yes, because then the hips go up, then the knees and the spinal alignment is maintained. Or if you have a chair like this, okay, sit like this. Yes, without any support. Okay, we advocate no support has to be taken when you are working, because if you are taking support, your muscles stop working, and we don't want that. We want a complete co-contraction of your extensors and abdominals, right? So this is the way you should sit. So whatever coming on Amazon, lumbar support, very bad. We never advocate our patients to use a cervical collar, to use a lumbar support, because the moment you start using it, it will be comfortable for your patients, but it is not comfortable for your muscles. Okay, the muscles stop working at that point onwards. Okay, so we try to wean off patients from their braces, even after ACL reconstructions also. We tell our patients, please do not use your braces. So within a week, our patient is off the brace, right? So this is how
the revolving chair,
the revolving chair is this, man. Or if you don't have this, what you can do, you get those throw pillows, right, which we keep on our sofas. Just keep it underneath your seat and work it out. Okay, the laptop screen has to be at your eye level. Please use mouse when you are working on the laptop, not that. Yeah, because what happens when you are using this sliding board of that laptop, you go into this sort of a posture. We don't want that. Okay? Because when you're going into this sort of a posture, your scapula, which is like this, is going into this. Okay? And to compensate for that, your neck goes like this.
Yes.
So this is the point where you start having the musculoskeletal changes. Okay, so always use a mouse. The screen has to be at your eye level, right? Never use a support, lumbar, pillow, nothing. It is off support all the time.
How much
Elevate.
constantly?
No, I will tell you. So your chair has to be elevated, okay? Either you have a static chair, elevate that, you have a rollator, then you can use this, or you can just use a throw pillow, that is quite available. Okay? Now one thing is that our body is not meant for a static postures. Okay? So our body is meant for mobility. Okay? It is all the muscles and everything needs work. Then only their metabolism is maintained within normal limits, right? So when we are making the body to sit for a prolonged period of time, okay, it is going to go like this because gravity is constantly acting on us. So it is within 5 to 10 minutes, you see that you can sit like this for 10 minutes, not more than that. Then you go like this, slouched posture automatically. That is the habit. So what we tell our patients, you sit like this, okay, but after every 30 minutes, you need to take break. What is that break? That doesn't mean that you have to get up, take a walk and come back, because many of the patients tell us that they are so engrossed in their work, then अगर जो उठ जाते हैं चलते हैं तो सब मैम लिंक चला जाता है, तो आप ये क्या काम करते करते उठ जाओ. Okay, so you do your work, just stand up for 2 minutes and sit down. That will not break your link. Or something called as the thoracic extensions, right? Okay, so what you have to do is you can go behind, okay? Press your elbows on the support and bring your chest forward. Maintain this position for 2 minutes after every patient that you see. Okay, so in your clinic, suppose one patient is taking half an hour of yours. Okay, उसको पेशेंट को जाने दो, छोड़ने की भी जरूरत नहीं उसको दरवाजे तक. Just go back in your chair, okay, और ऐसे करके बैठो 2 minutes. It will relieve all the strain on your spine. Just come back and start working again. Okay, this is the way you should be sitting for a time wherever you want to sit, right? और ये करने का भी अगर you don't have that much of time, just get up when you are talking to your patient and just sit down in between. Okay, that is
Talking to your patient standing.
yes, no problem. Yes, okay. Then after just 1 minute, ma'am, let me finish this. Then after that is how you stand. Okay, usually we stand. There are various methods of standing. Someone is standing like this, okay. So the ideal way of standing, whenever you are standing, it is the shoulder width distance between your feet. Okay, always. That is the basic support that your body needs. Okay, and if you are going to stand for a prolonged period of time at one place, especially the housemakers, that they are working in front of their kitchen ota like this. So what we tell them, usually what the housemakers do, they keep a lot of distance between the surface, right, and their body. So what we tell them is just rest like this. So the entire weight is taken by the kitchen ota and nothing comes in between. So your spine is completely relieved of tension. Okay, this is the one trick that we all advise them. Then the next thing is that whenever you are doing that, भाजी बनवतो ना आपण, so we आपण ढवळतो ती किंवा chopping करतो. So that time many of our patients यहाँ पे दुखता है मैम. Okay, so what we tell them, it is because the trapezius is not acting well, upper trapezius. Okay, it is either overacting or it is not acting. Okay, so what we have to tell our trapezius or train our trapezius is continuous work करना है, because it is one of the postural muscles. Okay, so what we tell them, whenever you are doing that, okay, just elevate your arm a little and just try to do it. Okay, it is going to come down because of the gravity, but when you become aware of that, just keep it up and do that. Okay, or if you are taking a purse and you are doing this, okay, so just elevate your arm and take your purse. So entire your upper trapezius takes the load of your neck and the shoulder. right? And upper trapezius can take a lot of load, trust me. Okay, so this is the trick. Or if you are carrying a backpack, you have to carry the backpack, just take your arms and go ahead. After that, because of the motion of the gravity, that they are going to come down. But once you realize that they have come down, just take it up little. That's it. Okay, I'm not saying you have to keep on walking like this.
Somewhere only one sling, somewhere only one.
Yes, that is what. So if you are trying your backpack like this, okay. So I am just saying this much of activation and walk. So okay, so when you are carrying a backpack, it has to be this much of activation and walk. Eventually it will come down. When you realize it has come down, just take it up. Okay, next time when you are taking rounds, especially the doctors, okay, you are going from bed to bed. So whenever you are walking or whenever you are standing for a prolonged time, especially the surgeons, what we advise, in that position itself, just try to do this. Yes. Okay. Or if you are going to stand, suppose for professors, you give lectures for long hours, what we can do is have a small stool and you stabilize yourself like this, and after every half an hour you can change it. Right? Now there is a method also to climb up the steps and climb down the steps, because since now in India the osteoarthritis epidemiology wise is the incidence is a lot. Okay, so why it is like that? Because medial compartment is all the time stressed and the people develop the varus deformities, and we have come across many people who are having difficulties going up the steps and down the steps, and then they start avoiding getting down and up, going up. Okay, so best mechanism for that is whenever there is a varus deformity, okay, I'm talking a little bit of biomechanical terms, our tibia goes into rotation like this. Okay, so we need exactly the opposite force. Okay, so whenever we ask the patient to climb the steps, what we ask the patient to do is keep your forefoot. Okay, of course the railing is there. Keep your forefoot on the step. The heel is out of the step with the external torsion of the tibia, and you have to climb the steps like that. Yes, it is a kind of duck walk, but it is necessary in order to prevent yourself. I am not saying you have to walk completely rotated. Even this much of rotation is enough. That is 10 to 20 degrees, and you can walk like that. Okay, when you are descending the steps, of course you want to descend it. Turn your tibia outwards and descend down. If you do this, it will take care of your knee health also. Okay, so going up, going down is very, very important. Then next is, if you are using your body like this, there are 95% of chances that you will not land up with the postural syndromes, but there are 5% still are the chances that you will have. And then there are multiple factorials which come into picture, the leg stress and everything. Then that has to be dealt with those aspects. And then I would like to tell also this, that whenever people come with the acute spasm, that is a natural tendency that we tell our patients, thoda sa stretch kar le. You are not supposed to stretch, because the muscle is into protective spasm. If you stretch it more, it is going to spasm more. So it is not helping your patients at all. Okay, so if you try to stretch it, the person is going to come with a lot of pain next time when he is coming to you. Okay, so that is a bad idea to stretch. What you are supposed to do, in physical therapy, we call it as a optimal loading. Okay, so optimal loading is what? If my upper trapezius is painful, what is the action of my upper trapezius is to elevate, right? So I will tell my patient that you are supposed to keep on elevating your shoulders, but to the extent where you will have no pain. So we give them a lot of static loading. So against the resistance, without inducing any pain, patient has to contract. Maintain that contraction for a prolonged period of time, let's say 1 minute, 2 minutes, and take down. Doing this for 10 seconds, 10 repetitions. Ideally, it was the protocol previously. Okay, 10 repetition, 10 seconds. Okay, but nowadays it is endurance plus strength that we talk about as a stability. So we are working more on a stability rather than the only endurance part or only the strength part. Okay, so if you want the strength, you need to activate that muscle. If you want the endurance, you would like to maintain the muscular contraction for a prolonged period of time. So both together. So contracting it against resistance, maintaining it for a 1 minute or 2 minutes works for almost most of the patients. Right? So this is about the daily chores ergonomics. Next is most of our times our maids, they complain of back pain and then they don't come for the work. Yes, especially the pocha wale, jadu pocha karwale baika kiva bandi wale baika. Okay, so what little thing that you can do for them so that they will not land up with the pain. So if you are sitting down and they are washing the utensils, give them a small stool to sit. Okay, and tell them that they have to bend forward like this, not like this. So it is the log like this. Okay, or if you have that mop, that is the good way to do it. Okay, for if they are still doing jhadu pocha like this, so they have to keep on alternating their legs like this and they have to bend down like this. Okay, so at my place, Bali doesn't take a leave because of back pain and neck pain because I have taught them how to use that. Okay, even our roti makers, they have to stand like this, elevate their arms and do this. Okay, so this is how you can work your body out when you're using it into, and we don't pay attention to it. These are the very small changes that you can do at your workplaces. Okay, then the most important thing nowadays, we cannot live without our mobile. So when you are seeing our mobile, of course your privacy will be disturbed with this, but always have something underneath your elbows. Keep it like that and see it. Okay, not seeing it like this, like this, like this, like this. Okay, so your neck, your mobile has to be at your eye level. If you don't have any support, keep your elbows at close to your body and just look at your mobile like this. I have not seen in the hall using the mobile, any of you using the mobile like this. Okay, so that is how it. Yes. Next is there is a lot of debate like this. So you should not be doing this. This. Okay. And if you want to turn and see, turn completely and see. It is not this. This. Okay. So turn completely and see. Then that takes care of your spine. Right? So all this is going to take care of your parasympathetic system as well. So you're reducing the allostatic load by using your body properly. Right? Yes. The next thing, the most of the debate goes on whether to use a pillow. Yes. So, in my opinion, you should use a pillow. Okay, there is no problem when you are sitting in supine position like on your back. Okay, no problem if you are sleeping without pillow. But when the problem comes when you are sleeping like this. Okay, so your strain is coming lot on this traps and this. Okay, so when you are going on your side, you should have a pillow. How much should be the width of the pillow is your hand, finger width. Okay, so the pillow should be there, your head should be on the pillow and the shoulders of the pillow. Okay, and one more thing, if you have habit lying on your tummy, that is the best habit because lot our chores, day-to-day chores are involved all the flexion activities. We hardly do extension activities. So nowadays studies are coming up that the people will start eventually in evolution no extension. Okay, so for that we need to have the prone lying positions. So maybe when we are trying the relaxation also, instead of lying in the supine position that we tried yesterday, we can try in the Makarasana position and do that because it is going to inhibit a lot of flexion and going into extension. So something like activating so there are myofascial chains. Okay, so I just yesterday I said that our hair to the nail of our toe, everything is connected. And how it is connected? It is connected via fascia. So there is something called as myofascia that covers up our muscles. Okay, and we are now activating. Now the physical therapy is advancing, activating or taking care of that myofascia. like the myofascial chains. So you have the extensor chains, you have the flexor chains, you have the side chains. So even though my upper trapezius is problematic, the problem may be somewhere in my calf, in my extensors. So I need to take care of all that and treat this. So the localized approach is now becoming again the holistic approach, taking care of the body as a whole, not just the one component. Okay, so this is about the ergonomics. Okay, then is when even though you are following all this, sometimes it happens that the body lands up with aches and pains. So there are small tricks that we tell our patients is something called as flexion biased and extension biased exercises. Okay, but there are rules to do these exercises. The first rule is you should be absolutely comfortable when you are doing these exercises. Okay, since there is a saying that no pain, no gain. Okay, but without pain also you can gain. Okay, that is what we follow. Okay, so you should be absolutely comfortable when you are doing these exercises, which is a spinal health exercises we call it as, and it should be absolutely comfortable. So whenever you find your first comfort, wait there. You are not supposed to progress beyond that range, the first thing. Then there should not be any pain in your body. Okay, and next thing is you have to continue your breathing normally. So do not hold your breaths. And that exercise position needs to be maintained for some period of time. As I told you that it is the stability plus the endurance plus strength. So it is the stability. So now the approach is coming up. It is not just the endurance and the strength. It is both together that we need to work. And maybe we need to see the heart rate variability when we are working out like this. Okay. So the first exercise that we do is making the patient lie down like this. Okay, and just lifting up the pelvis. This is, we call it as a posterior pelvic tilt along with the gluteal activation, right? As I have told you that there are a lot of many flexion attitudes. This will take care of the activation of the main muscle of the posterior chain, that is gluteus maximus. And this position we tell our patients to maintain for 2 minutes. If the patient is telling you that I cannot maintain it for 2 minutes, what you can tell them that break down. 1 minute, go down, 1 minute. But we never allow our patient to go like this. 10 repetitions of this. Okay, so this takes care of the stability. Next exercise is this. Okay, many of the yoga positions, they have this position. Okay, but we are not asking our patient to go into this reach. So wherever you are comfortable, even if they are comfortable in this position, we ask them to hold on to this. Okay, the next exercise, this is also maintained for 2 minutes. Next is, we call it as a thoracic extension, that bend your elbows and just press down your elbows. So now all my spinal extensors, that is erectus spinae group, is now activated at the thoracic level. We hardly move the erectus spinae at the thoracic level. So this is the best exercise that you can engage them into, right? Maintaining it for on the elbows, okay? And the chest is coming up, right? Okay, maintaining it for 2 minutes. Then going into the prone position and holding this again. This is one of the most famous exercise, yoga pose, and holding into this. Then is the hip extension, Shalabhasana. Okay, but many of the times I've seen people who are practicing yoga, hip extension range is up to 15 degrees. Not more than that. That much is the hip extension. These people go on activating it more than 15 degrees, 40 degrees also, jahan pe you start moving your lumbar spine along with the pelvis. That is not the hip extension. So if you want hip extension, it has to be limited to 15 degrees of hip extension and maintain it for 30 seconds. And then next is the quadruped position. This we call it as a Superman pose, okay? And going in this for 30 seconds and in for 30 seconds. If you follow this routine, once you get up in the morning and once you go off to bed twice, this will take care of your spinal health, lumbar health. Now if you are doing a lot of cervical pain issues are also there. So the simple exercises for the cervical spine, lot many exercises, lot many people give the static cervical, okay, that is this, okay. So in this doesn't work because actually the patient will come to you with the forward neck posture, and if you are asking them to do this, they will tend to go like this. So you are actually again accentuating the problem. So what you need to do is just the extension biased exercise. Okay, this. So you have to clasp your hands, put it back of the head, bring your elbows forward and just push your head and hand against each other and stop where you feel the first comfort. You don't have to, I have seen patients do like this. We don't need that. Okay, so wherever you feel first comfort, stop there and maintain that for a prolonged period of time. Let's say 1 minute or so, right? Then after that is the elevators, that is the upper trapezius, which is the most neglected. Okay, I have seen many people who do elevation of the shoulders this way, but most of us, because of the gravity, have the position of the scapula like this. Okay, so if you are doing elevation like this, you are going to increase that tendency of the scapula to go more like this, and the tendency to have the drooping scapulae will increase. Okay, so what we tell is to change the attitude of the scapula. So take this position, okay, and elevate your upper trapezius. This is the good activation of upper trapezius. Okay, you don't have to do this, just do this and maintain. This is the elevation. Okay, even the retractors, if the scapula is like this, that most of us have, okay, if you are activating the retractors, it is going to pull the scapula in this direction, again accentuating your downward position of the scapula. So what we tell our patients, go forward, keep your hands here like this and just retract and maintain this. Okay, so doing this retraction, what usually is taught is now replaced by this retraction, which is really healthy because you are taking care of the scapular position and the muscles are working at their appropriate length. So if the muscles are working at their appropriate length, then only you will have a good contraction of the muscle, right? So this is how you can take care of your cervical spine, your lumbar spine, right? The next, that which is very neglected muscle, is the pelvic floor, right? That you need to take care of your pelvic floor because pelvic floor imparts a lot of strength to your core. Okay, that is your back extensors, because all the muscles are connected to each other by dorsolumbar fascia. So it connects your posterior muscles also, erectus spinae group, your abdominals also, your diaphragm also, right? So a lot of breathing problem जिनको है, उनका pelvic floor भी weak हो जाता है. So the very simple exercises, people will not come to know that you are activating your pelvic floor. Everyone is sitting, right, upright. So now what you have to imagine is, you want to pee, okay, but there is no bathroom nearby. Okay, what will you do? You will hold it. Okay, so how you want to hold it? You are sitting in between two ischial tuberosities. In between that area, you have to just pull it up and hold. Maintain your normal breathing, right? And release. So you can maintain it for 30 seconds and release, right? So that is, we call it as a sustained contraction. And then there's something called as quick flicks. Okay, this can be done by males and females. Previously it was a misnomer that pelvic floor only exists for females. It is not like that. Okay, even males can do this exercise and it imparts a very good extensibility to your thoracolumbar spine and thoracolumbar fascia. You are stretching your thoracolumbar fascia, but you are not paying attention to the pelvic floor, which muscles are into trouble. Then the extensibility of the thoracolumbar fascia is not going to improve. Okay, so the pelvic floor needs to be given attention to. After multiple deliveries, the women are coming to us with a prolapsus, right? Then urinary urgency, or they are not able to, incontinences. So in them, after episiotomy also, and after pregnancy, that is the postnatal part, where the pelvic floor is stretched to a lot of extent, in them we are using these exercises. So whenever you are doing your yoga poses and everything, please make it a point that you are also activating your pelvic floor or the clientele's pelvic floor. That will help them to have a good breathing control, because the pelvic floor is connected to your diaphragm via thoracolumbar fascia, right? And your abdominal and extensors should work in co-contraction. There should not be one activating more than the rest. The one more thing that you should take into consideration when you are going into your fitness academies, okay, in them we do a lot of crunches, but we hardly do extensions. So whenever you are doing that, please make it a rule that how much ever pushing activities you are doing, सेम नंबर में opposite movements भी करो. Okay, so when you are doing crunches, do the extensions also. That is missed. So there is this protocol in the fitness labs that they work. One day upper limb, one day lower limb.
Yes.
Okay, but in that upper limb, please incorporate your torso. In that lower limb, incorporate your torso. Because torso connects the upper limb and the lower limb. And that is the main powerhouse where the energy is getting created and you are getting the transfer of the energy from the upper limb to lower limb. So whenever we get a patient of lower limb injury, let's say the ankle sprain, we train them for torso. And whenever we get a rotator cuff injury, we train them for torso. So this is how complete package is given to the patient. Thank you. Yes, the one thing that you can put is pillow underneath your buttocks. And one more thing that you can do, madam, is this is a special attention. So when you are doing this, okay, what we tell our patients, relieve the pressure. Okay, so one time this. So one patient goes, you are doing this. Okay, for 30 seconds. The next goes, you are doing this. Okay, this looks a little bit funny, but it works. It works for the patient. Okay, they feel awkward for
How much squats?
what squats, ma'am?
No,
No, what about squats?
Western closets is what
Clothes.
Closet. Indian toilets.
Indian toilets you can use. There is no problem. See, it is whenever the knee goes into flexion, we call it as a lot of shear forces are coming in between. Okay, but those shear forces, if the knee is healthy, are needed. So you should use the complete range of motion, that is 160 degree of knee flexion, important. But if your knee is diseased, let's say osteoarthritis, or let's say rheumatoid arthritis, or maybe because of the ligamentous instability. So at that time, those shear forces are harmful. So that is why we tell our patients not to sit down or not to use the Indianized toilet and go for a westernized toilet. But that doesn't mean that if the patient feels better and if the strength improves, some people of us have tried cross-leg sitting using Indian toilets and they are doing it. So you can use the arm rails going down and come up. So that is you can take care of the architecture there. Okay, so when you're going down, the patient holds it at the armrests given, he goes down and comes up. So whenever he's coming up, what we tell them is bend from your torso. So the most of the weight is taken now by the torso, the knee is offloaded and you get up. Whenever you're going down, also go down like this with the armrest. So this is how we are modifying it for the patients who cannot afford the western toilets.
He wants to know about how do you bend for pick up the things.
Yes. So whenever you are picking up things, usually we do this. So what we have to do is bend from your knees, okay, and go down. Okay. So if you are bending it, this we tell it to our rickshawalas. Okay, because most of the rickshawalas, they have a habit of doing this. So what we tell them, Kaka, come out, okay, do this and go back. Right? One time button start, one time this, because this is also needed. So whenever you are bending down, bend your knees and pick up, because it offloads your spine. Now the problem comes when the patient comes to us with the arthritis. Already FFDA or sometimes bending the knees is also a problem. So what we tell them, you sit on a surface and then try to pick up things. Okay, so this is the modification that we can do. Yes, I will come to it.
So while taking patients, madam, we do if it is end of the session or we type my reports are right, and then we tend to really go forward.
So ma'am,
what to get correction of posture?
So what you can do, ma'am, is the simple correction. Start using the writing pad. Okay. So what you have to do is, this is the surface, right? Okay, and keep the writing pad like this and start writing notes.
And typing?
Okay, not going like this and writing. Okay, yes. So you can do this and write. And you have to take care that whenever you are writing, we tend to write like this. Okay, keep your elbows close to the body, which will not strain your upper traps a lot. So these are habitual things, okay? So you need to pay attention to it at the early times, and then they will become automatic things. So you are creating an interaction. Okay?
चांगलं मग लोकांना गंमतीसाठी एक छोटा व्हिडिओ लावून देऊ आपण.
Okay? So this is the way that you should.
Since we are talking of habits, now we'll play a chota comedy.
And one more thing is about the footwear, ma'am. So high heels are the worst footwear that you can ever wear. Okay? Why? Because I have seen, if you have a job where you need to walk, while instructing the patients, where you have a job while standing, okay? So what high heels does is give you a lot of plantar flexion forces. You are all the time going like this, increase in the lordosis, which will cause a lot of force coming at your spine. We call it as a lock of spine, right? So then these people will start with the back pains, okay? Sometimes with the heel pains, sometimes the metatarsalgia that we call it as, because of the lot of pain. So जेव्हा तुम्हाला असं असेल की गाडीतनं उतरायचं आणि गाडीत परत बसायचं, तेव्हाच हाय हील्स वापरायचं. ओके? सो बाकी रेस्ट ऑफ द टाइम नो नथिंग वर्क्स मॅन. नो प्लॅटफॉर्म हील, नो स्टिलेटोज, नो नथिंग. ओके? It is for whom their profession is like that, we train them for that. Okay? But if your profession doesn't demand that, no need to wear that.
Flat, it also
Because you are not used to it. Because you're not used to it. No, box heels also doesn't work. Because in our institute only, we have done this study comparing the different heights of heels. Okay, the box heels, then the stilettos and the flat surfaces. The biomechanical changes are very less when you are using the complete flats versus the stilettos and versus the box heels. Sometime, ma'am, that is what I told you. For some time, कितने frequency में आता है, that we have to see. If it is for 1 or 2 hours, that is coming.
Walk normally.
What?
Walking in a stance doesn't like how do you walk?
No, you walk the way you are walking. The way you are walking. So if one more thing about the morning walks also. आता पुण्यामध्ये मातीचे रस्तेच राहिले नाहीये. So all are pavement roads, and that is the story everywhere. So you can't avoid that, and you have to walk on the pavement surfaces and the cement surfaces, but you need to take care of your footwear. If you don't have any hip pain, knee pain, lumbar pain, you can use your sports shoes. No problems with that, because it gives a stability to your ankle joint and you're walking, right? Next, but if you have knee pain, hip pain, lumbar pain, you're walking with the shoes, what is happening is, when we are walking, we are exerting some force on the ground. The ground is also exerting some force on us. That is Newton's third law. For every action, there is equal and opposite reaction, right? So if our ankle is not mobile enough because of the using of the shoes, okay, that ground reaction force is directly going to hit at the knee and the hip, and you are worsening the condition. Okay, so for our osteoarthritic conditions, for knee and hip and spine, we always tell them use slippers, Paragon slippers. They are the best, which will have a good ankle mobility, and the patient can able to walk without having increased loads at the knee and the hip and the lumbar spine.
What about those who don't have table and chair work areas? So either they will sit on a bed with their legs extended, or cross-legged with a small desk or something.
So the cross-legged position I have just showed, that you have to sit with the pillow underneath and the knees has to be down, and you have to use a writing pad always. So when you are reading, when you are writing also, the writing pad is the mandatory one that you can use. If you don't have a table, you can do this for yourself and write and then change, right? So this is the way that we tell them. Okay?
To let their legs extended.
That is not an issue. That is not an issue. Yeah, you can keep your, if you have good hamstring length, you can do that. No
Madam,
problem.
I have only one question. Ek minute, just one question. Just one question is that, yes, we do have lot of postural issues, everything.
Yes.
Is working out 1 hour daily on our muscles will take care of all these issues.
if you are working out with your muscles daily, will not take out the ergonomic issues. For that, you need to take care of your ergonomics properly. Yes, it is a 24 hours thing that you have to be aware of.
So awareness is the most important.
Correct. Yes. So you have to be aware about your body positions all the time. And please.
So now I think Namrata, there are a lot of questions here.
Youngest of all the presenters and totally full with enthusiasm. Shivram has already sanctioned a scholarship, travel scholarship, which I will tell her later. He has already approved her. Light बंद करो, इसे वीडियो चलना.